Hello, my name is Dr. Stanley Lang, and welcome to this broadcast. The focus of today's broadcast is on type 1 diabetes and how to have excellent control of blood sugars through the use of very low glycemic eating. So I talk a lot about diabetes and diabetes reversal using the low glycemic eating protocols that I've been establishing over the decades now. But what I wanted to point out today is that even type 1 diabetes, which you can't reverse because you're insulin deficient, can have dramatically improved control by following these same dietary strategies. Now, unfortunately, the American Diabetes Association still promotes a diet that allows people to consume high glycemic carbs as part of the meal. This always undermines the possibility of a type 2 diabetic reversing their diabetes. There's just no way you're going to reverse diabetes when you're consuming high glycemic carbs, and that's just part of the deal. But it also messes up the control for a type 1 diabetic. So when somebody who is type 1 diabetic, that means that they don't have enough insulin. They are taking extra insulin to control their diabetes. If, in addition to that, they eat very low glycemic, which means that they don't eat any foods that raise the blood sugar quickly at all, ever, it dramatically improves their control. And a patient that I just saw today who has been a type 1 diabetic a long time and recently had attempted to do the ketogenic diet, but was just a little bit too challenging for her. So she decided to go back to my modified plate diet strategy and finally started to follow it to a T, no exceptions. And her A1C, which is a marker of diabetic control, this time around was 6.5, which is very good control. It's almost into the normal range in the lab that we use. So this is more than 2 points lower than she was just 6 months ago. The point is that you can have very good diabetic control if you will follow the discipline of low glycemic eating and give up on the idea of that it's okay to eat high glycemic foods part of the time. It doesn't help you, and it will likely undermine you. And I want to encourage you that you can achieve very good diabetic control if you'll do this. So I wish you well in your wrestling with diabetes, even if you have type 1 diabetes. God bless and have a great day.